these are troubling times, and the urgency of the moment is definitely felt in this room today from all sides of the House. And, you know, we know that these are extraordinary times, but I believe that ordinary people can do extraordinary things, and we will do that in order to weather this storm. Across Canada, individuals are making sacrifices. They are socially isolating. They're doing everything that they can to slow the spread of COVID-19. Today, the Government of Canada imposed restrictions on people returning to Canada, asking them to self-isolate and making it mandatory for them to do so. And this is all in an effort to keep all Canadians as safe as possible. And this, too, is our task as legislators in this province. Indeed, it is our moment to make the decisions that keep Ontarians safe. Speaker, I want to say thank you to those brave individuals who every single day they stock our grocery shelves and cash out our goods. I want to say thank you to those building superintendents that keep our environments safe. I want to say thank you to the truck drivers who hit the road every day to make sure that the goods continue to move. And of course, a big thank you to the frontline healthcare workers, those care workers providing home care, long-term care, and community care. Everyone on the front lines that is there to protect our safety. All levels of government are taking important measures to ensure that people remain safe and that they continue to receive the income that they need during this turbulent time, and for sure that the economy has a light at the end of this and that it will rebound beyond this crisis. We're also working hard to ensure that the public has all of the information that they need to keep themselves and their community safe. The government's plan that was laid out today is the first step, a $17 billion package that responds to the immediate needs. Things like childcare, the $200 to $250 per child, that's going to be put to good use. And the gains, I know it's $85, but for the lowest income seniors, they might be able to buy some fresh vegetables and fruits. But Speaker, we cannot afford to be complacent. A tax-deferred plan that banks on all of this wrapping up by the fall is not enough. We cannot afford to be complacent. The people in this province are depending on us. We must be decisive, we must be deliberate, and we must be clear. Delay in any measure with this virus is unacceptable. Every day matters in order to stop COVID-19. So, Speaker, we're suggesting that the government takes immediate action to make sure that the people of Ontario have what they need. Ontario has a robust economy, and we will ensure that beyond this, workers and businesses will stand on their feet again. But right now, we have to lay the foundations to enable our economy to get back to work as soon as possible. So we're calling on the government to double the wage subsidy that has been provided by the federal government. Let Ontario do its part for each and every worker that requires it. We also need to ensure that our response protects everyday Ontarians and recognizes the unique challenges of the most vulnerable. Speaker, I want to speak today specifically to those in long-term care. You know, just last night, I received a very troubling report from a long-term care facility in my riding. One person was diagnosed last week, and by today, 2 members of that community has passed away. And I want to extend my condolences to the families and to the workers that care for those individuals with compassion. Speaker, they need our immediate attention. Testing of workers who are going into long-term care facilities. Personal protective equipment. Speaker, it should just be there when needed. I appreciate that my hospital is doing a drive right now for the community to make donations, but that's not the job that I believe that they should be doing. They should be working to make sure that everyone that needs medical support gets that attention that they need. So we're recommending the doubling of the personal and protective equipment from $75 million to $150 million, and more if we have to. The $1 billion in COVID contingency fund, it needs to be advanced to our healthcare system so that people get the support that they need. Those care workers that I mentioned, Speaker, in that facility, they've stopped testing. They've stopped testing staff. They've stopped testing patients and clients in the facility. Those individuals deserve hazard pay. They deserve to get the respect that they need as our care workers. Speaker, I believe that we will weather this storm and that we will get beyond it. And as the government has said, we will spare no costs in protecting health and safety of Ontarians. Well, it's time for us to step up.
Thank you very much.